Why are you losing your hair? Today I'm going to cover the main causes of hair loss and tell you which solutions are actually worth your time and money. My name is Caroline. I am a certified trichologist, a hair and scalp specialist, and I have dedicated my life to the research and study of everything hair and scalp related. I have finally decided to take my vast experience out of the clinic and use it to answer the most common questions I hear every day, as well as debunk all those myths. So why are you losing your hair? The truth is, the answer is pretty complex, and there are potentially dozens of reasons of why somebody is losing their hair. And it's difficult to know where to start because there are so many self-proclaimed experts online, and there's so many causes and solutions popping up on social media every day. So where do you start? Well, the easiest place to start is to really see where your hair loss falls into which of two different categories. The first category are chronic and progressive types of hair loss. So these are hair loss types that have been going on for some time, maybe a few years, maybe more, but you can definitely notice that your hair is getting a little bit worse every year. You may not know why, but every time you check your hair, it looks a little bit different from month to month and from year to year. The other category are hair loss types that are acute or sudden. This is a type of shedding that usually occurs within about the past 3 to 6 months, maybe up until a year. But you do notice a lot more hair loss falling in the shower when you're brushing it. Again, you may or may not know what triggered this type of hair loss, but it definitely hasn't been happening for a long time. Let's start with chronic progressive forms of hair loss. So these are types of hair loss, again, that have been going on for a long time. Your hair loss maybe falls into a specific chart, a specific scale is the better word, or it's maybe, and especially for women, presents more of a diffuse pattern, so it's thinning all over. So two examples of chronic or progressive forms of hair loss are male pattern baldness or female pattern baldness, or male pattern hair loss, female pattern hair loss, also known as androgenetic hair loss. So these are hereditary types of hair loss. They have a genetic link. So genes, as we know, are very difficult to alter. You cannot change your genetic code. You can, however, alter your genes over time with various external and internal factors. Now, I'm not talking about going in and altering your genetic code. I'm talking about factors like diet, nutrition, health, lifestyle, stress. All of these things can accelerate a hereditary predisposition or potentially can also slow it down. So how do you treat chronic progressive forms of hair loss? So in these cases, I really like to stick to what I call the holy trinity of treating progressive hair loss. And the holy trinity of treating progressive forms of hair loss starts with 1, topicals. So topically, are you using something that is stimulating? Are you using something that is formulated, that is scientifically proven to treat hair loss? I'm not talking about using garlic and onion concoctions that maybe you saw, I don't know, a blogger use and it worked for her. The truth is, if there isn't scientific research behind the topical that you are using, it is very unlikely that it's going to work for you. It's possible that some of these home remedies have worked for small parts of the population, but if you want things to work for you, if you want a higher chance or likelihood of things to work for you, you want to go with something that's scientifically proven to work. Number 2, internally. So now we've covered the topical, but what's happening inside? Are there any deficiencies? Are there any hormonal imbalances? And the only way to find out this portion is by getting blood work done, of course. What do you check in your blood work? That's another conversation for another video, but you do need to seek a professional to help guide you with what bloods need to be checked, and also very important, what ranges to look at, not like, because of course there are ranges that your physical body needs, and then there are ranges to grow your hair, and those ranges are usually a little bit higher. Number 3 is clinical intervention. So topically, you're doing all the right things. your levels are within a good range to grow your hair, but how do you track your progress? How do you know you're using what you're supposed to be using for the right amount of time? You can go crazy otherwise if you don't have the right tracking and the right guidance. So you want to see a professional to make sure that you're taking accurate measurements, accurate pictures with a micro camera, with a camera. In my case, I also measure skin and I use a UV light to ensure that you are on the right protocol so that you have the best possible results. Clinical intervention also can include dermatological intervention. So of course, if you need a medication, if you need a medication both topical or internal, you need that clinical piece to this puzzle in order for you to see results. So with these three things in mind, these three elements in place, you're guaranteed to see a result. It's just impossible not to see improvement. The number one reason why I don't see improvement with chronic progressive forms of hair loss is inconsistency. You're doing one or two of these three things, or maybe you're doing all three, but you're not doing it consistently. You're not staying on a plan. You are not tracking your results, so you're not seeing any improvement. So now let's talk about the other category of hair loss types, the acute or sudden hair loss type. So this is where I'm referring to something called telogen effluvium, also known as TE. TE is a reactional type of hair loss. It is sudden, as I've mentioned a few times already, but what does that really mean? Well, it means that you are losing a lot more hair than is sort of within a clinical range of normal. And I know there's a lot of different ideas around what a normal amount of hair to lose every day is, but I like to say about 50 to 100 hairs a day is average. So if you don't want to count your hair, another clever way to see if you're going through TE is by doing a pull test. So if you pull through your hair and you're seeing a lot of hair in your hand every time, and I don't mean just every few days between, showers, every single time, it's possible you may be going through a reactional type of hair loss. So telogen effluvium, I also like to tell patients that this is definitely the best kind of hair loss to have, but also the worst kind of hair loss to have. It's the best kind of hair loss to have because, newsflash, it is self-correcting. It will get better. I promise you it will get better. There is a light at the end of the tunnel. But although there's a light at the end of the tunnel, it's also the worst kind of hair loss to have because it's extremely stressful. It's extremely distressing. You are literally having nightmares about going bald. And if that's you, then this may be the type of hair loss category that you fit into. So it's distressing, yes, but I promise you it will come to an end. When will it come to an end? Oh, that depends on a few factors. So let's use some examples of telogen effluvium. Some examples of TE are postpartum hair loss. So a few months after a woman delivers or has a baby, she can experience an extreme shed. Other examples are coming off a medication. More recently, I'm seeing telogen effluvium as a result of individuals having COVID. So this is a severe flu virus, and it causes fever, terrible things happen within the body, and 3 months later, all of a sudden you feel better, but you're losing a lot of hair. So telogen effluvium can occur for all of those reasons, as well as a long list of other reasons. But the best thing to remind yourself of if you're going through TE is, again, it will stop, it will end. How quickly? That depends on a few things. So under normal circumstances, telogen effluvium should resolve itself about 3 to 4 months after it started. What are normal circumstances? Well, do you have any deficiencies? Are there any other medications that you're on? Any other stressors? All of these things will influence how quickly you will recover from telogen effluvium. So the best thing you can do with TE is wash your scalp and hair often. This is tough. I know. I've been through TE. You do not want to wash your hair. In fact, you usually want to do the opposite, right? You see a lot of shedding, and even though I swear to you, all of the hair that you're losing is dead hair, you don't want to touch it. You don't want to massage it. You don't want to see it fall. Even if it's dead, you'd rather it be on your head than on the floor and in your sink. But you have to intervene, because the only way to come out of telogen effluvium is to wash your hair more often, massage it, use scalp care that is designed for your specific issue. So now that we've identified the two different categories that hair loss can fall into, or hair loss types can fall into, what are the solutions? So let's start with chronic progressive forms of hair loss. So the important thing to remember that solutions for chronic progressive forms of hair loss are really about building good habits. Remember, you are in this for the long haul. There are no cures for chronic progressive forms of hair loss. I don't care what people are advertising. It doesn't matter what you've been told. If there was a cure, everybody would be buying that cure. Nothing else would exist. I wouldn't be sitting here talking to you. But just because there's no cure for chronic progressive forms of hair loss doesn't mean that there isn't proper care. And what are some good solutions for these types of hair loss? Well, it's good. Some popular solutions and proven solutions are things like minoxidil, Rogaine, Regaine. These are clinically proven topicals that do absolutely work. I hear a lot of people not wanting to use this topical because they're afraid it will cause shedding when they stop. But guess what? You have a chronic progressive form of hair loss. So why would you stop? You wouldn't. You need to treat this for as long as you have the problem, which is probably going to be forever, if not for a very, very long time, unless you get a transplant. So, and even then you have to treat it. Some other things that can be done for chronic progressive forms of hair loss are in clinic treatments like laser therapy, PRP, which I mentioned earlier, of course, dermatological interventions, so prescription medications, both topical and internal, can also work very well for these types of hair thinning or progressive thinning. And you want to use that combined approach again. You need to use something topically, internally, and you need that proper tracking and guidance. So with telogen effluvium, it's a little bit easier. You don't need to run for the topicals that are very strong and stimulating and vasodilating. In fact, the biggest difference between reactional hair loss, or treating reactional hair loss, versus progressive hair loss, I think for me, is telling people don't use things like minoxidil topically. Minoxidil is really designed for hair loss that has been happening for some time, and it's for a variety of different reasons. Again, maybe for another YouTube video. The best advice I can give somebody for temporary hair loss is to wash their hair frequently, massage, use scalp care that is designed for their specific scalp type. So if they're very oily, or if they're very dry, if they've got scaling, you want to create the optimal environment for your hair to grow in. That is the key for telogen effluvium. And also, at the same time, being mindful of what's happening internally. Note that the rate of recovery from TE depends on other factors. So, you may have had, knock on wood, something like COVID, and you're feeling better, but your hair starts to shed. But maybe all of a sudden you've decided to change a birth control medication, or you've decided that, well, I'm going to become vegan. These things will determine how quickly you recover from the hair loss that you've lost after a severe illness. So it's important, again, to have tracking and guidance and have a professional guide you through this type of hair loss, even though it's temporary and self-correcting. And remember, please remember, there is a light at the end of the tunnel with temporary hair loss. Your hair will improve under the right circumstances. And somebody like myself, yourself, a certified professional is there to help you recover. So now that we've covered the two different types or two different categories of hair loss, if you see yourself in one of these different categories, or if some of these symptoms seem like they're you, reach out to a professional, get the answers. If you like this video today, if you learned anything today, please like, please subscribe, and tune back in every week where I'm going to be covering some new questions that you may have, new concerns, and debunking those hair myths. See you next time.